Hello everyone, this is Ambati Karuna Sagar, consultant pediatric surgeon and pediatric urologist, Ankura Hospital, Hyderabad. Hernias are different types in children. Most common hernias in children are umbilical hernia and inguinal hernias. Other less common are epigastric hernias and femoral hernias. Most common hernias in children are umbilical hernias and inguinal hernias. Umbilical hernia seen in infants usually after the umbilical cord falls off. It is actually self-limiting condition where umbilical ring contracts in size and closes by 2 years of age. If the swelling doesn't close by 2 years of age or when the defect is very large, child requires a surgical correction at the early age or after 2 years of age. Or the hernial swelling doesn't reduce on its own when the child is asleep or rest not crying, then also child requires an early surgical correction because they are known to cause obstruction and strangulation of the bowel involved. Inguinal hernias. Inguinal hernias are most common in preterm babies, which is seen up to 30%, and in a term babies it is seen from 3 to 5%. It is more common in boys than in girls. Usually the bulge in the groin is seen whenever the child cries or strains while passing stools. In the initial days, hernial swelling which is seen reduces on its own. The risk of inguinal hernia is strangulation and incarceration, where the bowel which comes out of the hernial ring doesn't get back into the abdomen. So, and the child will be in severe pain. Initially, it will be irreducible, later, it becomes strangulated. So, that is the reason any child with inguinal hernia needs to be operated at the earliest. The surgical options available are open inguinal hernia, where a small incision is given in the groin and surgical correction is done from the small incision. The other option is laparoscopic surgery. Laparoscopic surgery has an advantage of seeing the hernial defect on the other side, and if it is open, needs a surgical correction at the same time. Both of them are daycare procedures where the child gets admitted in the morning and gets discharged in the evening. The most common question asked by parents after the hernial surgery correction is child can go to play or do cycling or do running or involved in the school games. Usually, after the surgical correction, 1 month is a time period which we offer the patient not to involve in this physical activities. Routine home care, doing his own activities on the daily basis is allowed, but not involving into the physical activity. Thank you.